Okay, hi guys. My name is Ashley Foster. I'm currently enrolled in ODU's RN to BSN concurrent program, and I want to thank each and every one of you who did manage to come for showing up to my educational session. Today is going to be pertaining to the 6 rights of medication administration. And so, firstly, you do have flyers on your desks, and they are just like the bullet format of the 6 rights of medication administration. And obviously today, the purpose of today is just to ensure that I can give you all the information needed to help prevent and further reduce medication errors. So that is the priority of today, and then you will administer medication later on in the session. So to start off with, you can keep the flyers and take them home. So just to jump right into it, I know each and every one of you have had experience with medication administration because you've either been a clinical through by being a student nurse, or you have personal experience as a nurse administering medications, obviously. So this should be a basic review, but more so a refresher. So please take those flyers home, look over them, and just do as you want with them. So to start today, we want to start talking about what are the 6 rights of medication administration. And so they include the right patient, right medication, right time, right route, right documentation, right patient, right medication, right dose, right time, right route, and right documentation. I thought I was counting right. Okay, sorry. So to start off with the right patient, you do want to ensure that your patient matches the patient in the computer and the patient in the order. So firstly, you do want to verify that you get 2 patient identifiers for your patient before administering or withdrawing any medication. That is your priority. You do want to make sure that your patient matches his or her bracelet. You also want to make sure that that bracelet matches the order, or that name matches the order. So to ensure that your patient is who they say they are, you do want to ask for at least 2 identifiers, and that could be anywhere from social security number, their name, their date of birth. The name and date of birth are the 2 most common identifiers, and you could use the medical record number. So any of those, and you do want to make sure that what they're saying matches their bracelet, and then that the information, those 2 components match what is in the computer. So that's simple enough. You do want to make sure, I know sometimes bracelets get switched around and crazy things can happen. So it's just simple things like ensuring you have the right patient, just ensuring that your bracelet matches your patient. They make a big difference. Okay. So secondly, you do want to ensure that you have the right medication. There are medications out there you all know personally, whose spelling is pretty much identical to another drug. They might be similar in action or completely different, but there are very similar spellings in medications. And so it is very, very important that we take the time to ensure that we are grabbing the right medication, because if not, that could cause a very serious problem, especially if the patient has allergies or such. And you do want to make sure that your medication matches the order prescribed in the computer. Alright? So thirdly, you do want to obviously ensure that you have the right dose. You've got the right patient, the right medication. Now you want to make sure you're giving them the correct amount. Whether that means splitting a tablet, whether that means giving 2 at a time, and sometimes you do have to calculate certain things and administer it that way. So it's very important to make sure that you are aware of what the order says, the amount, and that you do whatever necessary to administer the correct amount. You do want to make sure that it matches. Okay? So the right dose, the right strength, the right dose, all of that's very important, because you could give someone too much, and that's not a good thing either. So the right time. If you've got the right patient, the right medication, the right dose, you want to make sure that you're giving it to them at the correct time. And that just simply means making sure that enough time has elapsed between the last medication administration. So you do not want to give somebody a PRN medication too close together, because that could cause drug toxicity or just overdose. It could just be really serious for the patient, especially if it's a very strong medication. So PRNs are not out of the question. You do want to ensure that they are also being monitored too. All right, and you do want to make sure that the time matches the time in the computer, or at least matches. You can go back and see when the last medication was given, and you want to make sure that if it's every 4 hours, you give it every 4 hours. Then there are windows which you can give it earlier or later, but you do not want to go outside of the 30-minute window, ideally. Okay? And so for the last step, after you've given your medication, you've ensured all the other 5 steps are correct, you do want to make sure that you are documenting everything correctly. And that just means that you are putting on there that you have the right time, the right patient, medication, and all of that fancy stuff. So you do want to make sure, and it's really just to help the oncoming nurse. So if anybody who's coming on after you, if you have not documented correctly, then it's going to make it difficult to understand what needs to be done. So you want to make sure you do have the time, the dose, that it is documented under the correct patient, and that all of that stuff is in one single area. And that, because if you forget to document, that's a really big problem. It's a really big problem. And also, if you make a mistake, you want to go back and at least make a note or make a correction of some sort in the system that, hey, no, this is not right, but this is. And that just really helps to resolve any confusion that could happen. So, like I said,